Hi everybody, so this is week 5, and this recording is on the 5 stages of the model presented by the Dreyfus brothers. So the article that I chose is the 5-stage model of the mental activities involved in a direct skill acquisitions. This is a model that was proposed in the 1980s. The original model had 5 skills, 5 stages that were presented, and then a 6th one was added. The stages are novice, competence, proficient, expert, and master. And to explain it a little bit better, I found this in a different article. The model is utilized for developing sophisticated forms of recollection, recognition, decision, and awareness, where it is possible to move from rule-based analytical novice engaged in active thought to the intuitive, experience-driven master of a particular skill capable of other activities simultaneously, which is probably something that we all strive to within our work environment. So what I ended up doing was actually going through the article and building a table that would hopefully kind of combine all the stages that were proposed by the Dreyfus brothers. During that article, they actually utilize 3 examples of the skill sets that they propose that go through the stages, or that are going through the stages during that discussion. That is utilization or acquirement of the second language, chess player, and pilots. And this was originally actually made for the Air Force. So the first stage is a novice, and this is a description of an introduction of a new knowledge without any prior experience. The new knowledge is described as features, and it is referred to as non-situational. So what you'll see is a table that is mental function. Some of it is referred to situational and non-situational, and that actually just refers to experience and not experience. So for the example, as a novice within a second language, you're learning phonetical rules, you're learning recognition of noises on the particular occasions. You have no idea how to correlate it or where it belongs. As a chess player, you can see the chess pieces as elements. You have no context or knowledge of the rules, of the movement of the chess pieces. And as a pilot, you're sitting in a cockpit. Understanding or reading the instruments is difficult, and manipulating controls you can do, but you don't know what it is that you're doing at this particular moment. Competence. With competence comes a little bit of an exposure and experience, and now you're able to recognize patterns. Features are situational versus the non-situational, because now you have a recollection of the experience, and there's some pattern that is beginning to establish. The authors actually argue at that point that our brain correlates with that, and what we see, for example, for further organization and storage and recognition. So here with competence, within a second language, you're able to produce a phrase because you're able to put some words together. As a chess player, you're understanding the terminology of the movement, king, rook, queen, and which way they're going and what is their modes of action to a degree. A pilot will recognize the verbiage as it applies to the movement of the plane, and the mental function that is recognized at this point is, again, recollection is situational, decision, and awareness is the same as a novice, though. The proficiency is the next step, and now we have more experience under our belt. We're no longer a novice. This is a lot more situational, and we are able to progress within our utilization of that experience. So as a second language, you now can combine phrases into a sentence. You are able to start conversing. As a chess player, you can develop strategic goals because you are now one step ahead of just knowing how a chess piece will move, but you're able to anticipate the next position. As a pilot, you are now not only able to keep the plane upright, and flying in the air, but you can actually land it. You can visualize the angles and maneuvers. You can adapt to some perspective. The recognition is situational. What I saw in the article that was interesting is the utilization of the word holistic, and to me that just means intuition. And so with a proficiency comes intuition. You're able to intuitively understand what comes next. So expertise is the fourth step, and that is somewhat of a final process prior to mastery, but that just means that you have gone 1 point above from your prior experience and knowledge base. So now the second language user will have fluent conversations with no conscious evaluation of rules of linguistics. And from somebody who is English second language, I can tell you that at that point, you're no longer translating or not translating as much to a degree from one language to the other. So you're no longer translating words within your own brain from your base language to your second language. As a chess player, you develop tactical ideas for each move, and again, not just staying 1 step ahead, but multiple steps ahead, viewing your chess piece and chessboard. A pilot, it's not just awareness of the flying, but there's an experience to each nuance. You're able to see forward clearer, and your awareness is more so intuitive than it was within the proficiency stage. Now the mastery, of course, I didn't list any of the potentials for the second language chess player and pilot, and that's just obvious. I mean, mastery for a second language person would be just a ability to switch from one language to the other, pure conversationalist with no hesitation of utilization or choice of words and grammatic. Proficiency, a chess player is a master level, and a pilot is somebody who is, to a degree, a Air Force pilot, or somebody who's done this for a very long time. And so now it is very much situational recollection, holistic recognition, intuitive decision. You are beyond just being an expert. The article of support that I actually looked at, and there were a couple of things that I looked, but one was more so towards development of competencies. So within a medical profession, we have competencies and skill sets that we meet, and so there was an evaluation of development of guidelines for these kind of competencies, and you can see that a lot with a nursing facility, with a nursing environment. You can see that a lot with even PA school environments and postgraduates, where a certain skill set is being taught and guided along until you reach a proficiency within it or an expertise within it. So within this article, the authors focused on a guideline development for completion of competencies. They actually use a competency-based medical education, the CBME model first, which states 3 competency levels: development of guideline structure, judge quality of the evidence, and then change evidence to a recommendation. But they also discussed the Dreyfus, and I copied and referenced the guidance of the Dreyfus model that they utilized. And so within the example role, you can certainly place any of the expert or a member or a clinical position to utilize. So even if you put a medical student, an intern, guiding through those levels, or a skill, let's say a suturing skill. So as a novice, your suturing skills are just that of seeing a needle for the first time, knowing how to handle it with a needle driver, understanding what is a forceps. So you can see the instruments. You should hopefully know the knowledge of the instruments. but not know how to handle or what to do with them. Within the level 2 and competence, you should be able to teach how to handle the instrument correctly, and then have a workshop for the suturing, which is actually pretty good because they actually discuss how to attain that. So training events and workshops. With a proficiency, you're able to know how to throw a suture within a layer of the subcutaneous, subcuticular, dermal. Depends on the suture. You know one different closures versus the others, and then certainly expertise and masteries as a different level, and the mastery are those that teach the classes and teach the courses. So hopefully this helps. These are the references that I used. Sorry I went over a little bit. Thanks.